from our part, certainly, from the GHA's point of view, the quicker that we can do this, the quicker we can return to normal. And of course, it's always about safeguarding not only the population health, but really it's about admission into hospital, because we want to avoid the pressure that a high number of positive cases places on the hospital.
Do you know roughly how many cross-frontier workers you expect to include in the vaccination programme?
We're not sure at this stage. At the moment, the only cross-frontier workers who we have vaccinated are the cross-frontier workers who work in the health and care sector for obvious reasons. It's important that everyone's immunised if we want to achieve that level of protection. You will recall when we announced the priority categories for vaccination, that cross-frontier workers are included in that. They are the last priority. And but it will be cross-frontier workers who meet the criteria in terms of people who work in frontline services. This is about protection for Gibraltar. It's not about whether you live in Gibraltar or not. It's whether you are in Gibraltar and come into contact with people in Gibraltar to the extent that you may pose a risk of spreading COVID.
But we understand that the cross-frontier workers, even if they're working frontline, if we put aside the GHA and care workers, they're being asked for GHA cards, and some of them don't have GHA cards because even though they pay their social insurance and are fully registered locally, they have never thought that they needed to take healthcare in Gibraltar.
No, in those circumstances, such frontier workers will be given a temporary registration number, temporary GHA number, in order to enable them to take the COVID vaccine. The reason is that we need to ensure that they're in the system so that we have a record of the serial number of the vaccine and what batch number it is, and then we'll obviously issue them with our GHA COVID vaccination card so that they have it for their records. But it's not a question of people being required to register for a GHA card because they're allocated a temporary number. Obviously, unable to do so, then we need to get their details and confirmation of who they are.
So if anybody's watching this that is in that situation, how can they go about obtaining that temporary GHA number?
At the moment, we are not vaccinating that cohort of individuals because they're not in the current priority list. When we do get to those individuals, then we will advertise what the procedure for them is. If at the moment they are being called because they work in the front line in clinical areas, then we will deal with that situation in-house because obviously they are working in the health and care sector.